This panel was recorded Friday, March 19, 2021, during the 15th Annual Public Administration Research Conference, hosted by the Center for Public and Nonprofit Management at UCF. The panel is moderated by Dr. Greg Buckingham. It is titled, Responding to Risk During Crises.
Let's us go ahead and get started. I'm Greg Buckingham. I'm a faculty member at School of Public Administration at University of Central Florida. And I spent a career at NASA as a practitioner and then retired and have been teaching for several years now. We've got a good panel today about focused on the topic of responding to risk in crises. And so I think it'll be, we've had a few crises the last year, I think. So this will be a good topic. As I read the paper abstracts, though, there is an element of for each presentation of social equity. And so that'll be an interesting sidelight to the discussion. You can post a question anytime, put it in the chat room, or you're welcome to just use your mic. What we'll do is we'll have each of the panelists introduce themselves, and then we'll work our way back with presentations, and we'll take a question or two after each presentation, and then more at the end after everybody's had a chance to speak. All right, so we'll start off with Fatema Ahmed introducing herself.
Okay, thank you. My name is Fatema Ahmed, and I am a third-year doctoral candidate in the Public Affairs program in the School of Public Administration at the University of Central Florida. My research includes health services and health policy with a focus on substance use disorder. But I have an underlying theme across those interests of a core interest of vulnerable populations. So I'm interested in various projects that explore vulnerable populations in both health and policy context. So that's why today I'm going to be talking a little bit about food insecurity, and because that is consists of a vulnerable population. So thank you for having me today, and I'm happy to hear about all the other panelists' research as well.
Everyone, I'm Tamara Dimitrijevska-Markoski. I'm UCF alumni. I got my PhD in public affairs in 2017, and I'm assistant professor of public administration at Mississippi State University. When I was a doctoral student, I always used to present at a park conference at UCF, and I always enjoyed that conference. That's why I'm now here to connect with the current UCF PhD students and faculty. So today I'm going to talk about the COVID-19 crisis and ethnic and racial disparities. I'm going to talk about the impact of organizational learning and organizational culture on performance information use for reducing racial disparities. And specifically, I'm focused on county governments in the US. So this is the overview of today's presentation. I'm going to start by talking about the research problem, then talk briefly about COVID-19 and the racial disparities. Then I'm going to talk about the measures adopted by local governments. And then I'm going to provide brief literature review on organizational learning and organizational culture. I'm going to present the hypothesis of the study, and then I'm going to talk about the methods, result, and conclusion. So it's been now, and we all have been affected by COVID-19. It touched almost all our aspects of our everyday life. However, COVID-19 has had a disproportional negative impact on racial and ethnic minorities. Compared to white, non-Hispanics, Black or African Americans have 1.4 times the cases, 3.7 times the hospitalization rate, and 2.8 times the death rate. Hispanic or Latinos, they have 1.7 times the cases, 4.1 the cases of hospitalization, and 2.8 times the death. So even though now we have information that COVID-19 has had a disproportional negative effect on ethnic and racial minorities, we do not know what actions, if any, have local governments have taken to reduce these disparities. The management for result reform, for which Donald Monica yesterday talked in great detail yesterday, was focusing on getting performance data. The belief is if you have a data, you will use this data in decision making. However, as of now, we do not know if governments have used this data on ethnic and racial disparities and whether they have taken any action about that. So what are the aims of the study? First, I wanted to examine what type of COVID-19 data county governments collect and consider. Then how much efforts local governments put in reducing COVID-19 racial gap, and then which dimensions of organizational learning and organizational culture are more relevant for reducing the COVID-19 racial disparities. So just to give you an example about the racial disparities, for example, in Chicago, only around 50% of the population are African American. However, they had more than half of the COVID-19 cases and around 67% of the deaths. Why they are more negatively affected is because minorities are more likely to live in densely populated neighborhoods, and those neighborhoods are of lower socioeconomic status, which makes social distancing more harder. In addition to this, ethnic and racial minorities are more likely to work from home, are less likely to work from home, and are more likely to work in essential occupation like food industry, transportation, or even the leisure industry. In addition, many of them are uninsured or underinsured, which means that it delays the speed with which they seek healthcare, which explains the higher hospitalization and death rates. The food insecurity rate, which is traditionally around 11%, jumped to 38% in 2020. And in rural areas, people do not have adequate access to internet. And I live in Mississippi now. That's not something I ever thought of when I lived in Orlando. But now in Mississippi, we realize we do not have broadband internet access. It's really hard to have internet, especially those people who are from lower socioeconomic status, who do not have access to internet, which makes it harder for them to search for jobs and for their kids to attend virtual schools. So to put it simply, during the COVID-19, we are all in the same storm. However, we are not in the same boat. Some are in these fancy yachts, some are just swimming through, right? So therefore, I wanted to examine what actions have governments taken to reduce these racial disparities. So what governments have done, and I think all of us are familiar with some of the measures which have been adopted, is that many of them issued emergency declaration, they banned large gatherings, closed schools, bars, gyms, they reduced the indoor and outdoor capacities of restaurants, they issued stay-at-home orders, right? And to some extent, some of these orders have been seen in almost the whole country at varying times. However, some local governments have taken additional steps to provide safety and security for the residents, and they provided free masks, free cleaning supplies. Some of them provided or coordinated food supplies, free mental health services, or even provided free internet access or hotspots or other services. So the organizational learning, it's not a singular concept. It's a concept which has multiple dimensions. And basically, for one to organizations to learn, they have to collect the information, analyze the data, and then try to make sense out of this data. According to Monica, he said that the learning forums is the reason why we see this disconnect between availability of performance data and uses data. In other words, governments do not have a place where they discuss and analyze the data and try to make decisions out of it, which means that organizational learning is the key concept which connect availability of data and use of this data. In addition to this, the organizational culture also influence the use of performance data, and those governments or organizations that have innovative culture are more likely to use performance data. So the hypothesis is that organizations which have higher organizational learning, they're more likely to put higher efforts to reduce the COVID-19 racial gap. And organizations which have developmental or rational culture are more likely to put higher effort to reduce COVID-19 racial and ethnic disparities. So these are some of the variables. I did not present all of the measures here. However, the dependent variable is the efforts the government's place to reduce the COVID-19 racial and ethnic disparities. Independent variable is organizational learning, but each of those sub-processes is modeled individually, like information acquisition, information interpretation, existence of a framework for consensus, procedures for institutionalization and broadening of knowledge, and force of management. Organizational culture is also rational and developmental, and there are also some control variables such as capacity, population, median, income, poverty, and non-white population. Most of the variables are measured on a Likert scale to 1 to 5, and then they were created an index variable, which was I calculated the reliability using the Cromba alpha score, and all of them were valid measures having a Cromba alpha score of above 0.7. So that's briefly about the measurement. If you have any detailed questions about the measurement, we can discuss this later towards the end. What are the methods of the study? I selected 6 counties from each of the US 50 states. I selected the 2 largest from each state, and 4 were randomly selected. There were certain states like Delaware, Hawaii, and others which do not have more than 3 or 5 counties. Therefore, I took 3 or 5 if they had less than 6 counties in the state. I administered online survey between October and December of 2020, and I sent this survey to elected and appointed officials in 295 local governments. The response rate is 33%. I received 140 responses, representing 98 counties from 43 states. So who are the respondents? Not everybody identified the gender, but most of them were male. Around 48% were male and 38.6% were female. Most of them were elected officials. The rest of them were appointed officials. Majority were above 55 years of age, and then they had completed college degree and they had graduate or professional degree. Predominantly, they were white, with 70% of the respondents being white, black for 10%, and only 2.1% were Spanish, Hispanic, or Latino. 41% identified themselves as Democrat, 27% as a Republican, and 10% as independent. So one of the questions that I asked was, did your county government provide these services? And then they answered yes or no. And then those who answered with yes were receiving a follow-up question: how much effort did your county government put into providing this service to Black and Hispanic residents or locations convenient to them? So as you can see, almost 85% of the counties, they provided free face masks and hand sanitizers. Around 72% provided or coordinated free food or free pantries, and around 55% provided additional Wi-Fi locations. So out of those who answered with yes, this is the effort in percentages of how much effort they put in providing this service to the Black and Hispanic residents. And as you can see, most of them answered that they put a lot of effort or a great deal of effort in providing these services to Black or Hispanic residents. However, the biggest effort that they placed was in providing free masks and hand sanitizers. There was also another question which asked how you generally characterize the assistance to Black and Hispanic residents. And as you can see, almost more than half of the respondents said that they did a good job or excellent job in providing assistance to Black and Hispanic residents in dealing with COVID-19. So now we come to the regression analysis, which examines whether organizational learning, organizational culture influence the use of performance data for reducing the ethnic and racial gap. The first model was just with the control variables, and that explained around 25% of the variance. The second model, which is the number 2 here, includes all the variables, including control and the variables of interest. And here you can see in the information interpretation is statistically significant and has highest impact on the efforts to reduce ethnic and racial gap, and this is followed by developmental culture. Then the median of the county government, which was taken from the census data, is also statistically significant, meaning if the county is located in a wealthier area, they're more likely to place greater effort in reducing ethnic and racial disparities. Capacity did not have statistically significant effort, meaning it's not that the counties do not have the capacity, but probably the environment in which this county is located, the residents, the wealthier residents, more concerns for equity compared to those who do not have that. So generally speaking, most of the county governments collected data on COVID-19 cases and deaths. They also collected data on availability of hospital beds and equipment. However, very few of them actually examined impact data such as unemployment, loss of revenue due to COVID-19. And then, importantly, this study confirms the previous research that says that information interpretation or learning forums are key for use of performance information, and this is relevant for reducing COVID-19 disparities as well. Developmental or organizational culture also has positive impact on the use of performance data. That's all. Thank you.
Very interesting. Any questions or observations from the group?
So I guess I have one question. For when you distributed the survey, how did you define to them what you meant by effort exactly? How did they interpret the different degrees of effort when they were answering that?
So there was no definition. It was, did your county government provide a free mask or free sanitizers? And the answer yes or no. And then when the answer yes, they get additional pop-up question, which has how much effort did your county government place in providing free mask and hand sanitizer to the Black and Hispanic residents in your community? And they responded with none at all, a little effort, moderate effort, great deal of effort, or excellent or very big effort. So it was up for them to interpret how much effort they provided. Obviously, for some respondents, it may be excellent or great deal of effort. For some, may be some effort. So there is no standardization in terms of how they understand the effort levels.
Mm-hmm. Thank you.
Yeah.
What would you hypothesize? We just passed this rather large COVID relief bill, and some of that money is going to go to states and counties. Would you hypothesize that counties that have less income, that are in a less affluent area, might do more now that they're receiving that money? Or do you think it's more related to the existing processes that they have set up?
I don't think this will have an effect. I sincerely think that the main problem which this issue shows, and it confirms previous literature, is they just do not analyze the data. They don't think they have to act upon this data. And even when I administered the survey, I received some feedback saying, why are you even asking us these questions? COVID-19 affects everyone. And I'm saying, it can affect everyone. However, the data shows these groups have disproportional negative effect. So some people think they should not act upon that, and whatever they provide for everybody should be good enough. So one blank response is the way to go. So I don't think that the money alone will change it. And I think some of the biases that Monica was talking yesterday probably come into play in why they discuss and analyze the data compared to in front of their eyes, because now we know they have the data.
Right. Thank you. Okay. I think we will now go to Fatema. Okay, take it away.
Okay, thank you. So good afternoon, everyone. Today I'm going to be talking about food insecurity and social inequality during COVID, as well as some policy tools to promote equality and resilience. I'd like to acknowledge my co-author on this paper, Rebecca Entris, who's also a PhD student in my program. Just to give an overview for this presentation, I'll start off by giving you a brief introduction to the social problem of food insecurity. and how we believe one of the fundamental causes of food insecurity is social inequality. And we'll explain that through the lens of conflict theory. And then I'll connect the two and show their application specifically to COVID-19. And then I'll end by discussing some policy recommendations and some future directions for research in this topic. So food insecurity is defined as a lack of access to adequate, safe, and healthy foods. And this has plagued the United States prior to the pandemic, with nearly 11% of households in the US reporting being food insecure in 2019. However, during COVID-19, it has been exacerbated significantly. Early reports suggest an almost 245% increase in food insecurity in 2020. Moreover, food insecurity doesn't affect all segments of society equally. Both before and during COVID, rural, low-income, African American, Hispanic, and the elderly communities have been disproportionately impacted by food insecurity. So in response, governments are increasingly focusing on resiliency plans, and resiliency is a concept where people and communities are able to return to normalcy following stressors and disruptions. However, research is showing that many traditional approaches used by government are not always benefiting the people that need it most. So for example, when examining resource distribution following a natural disaster, various studies have shown that low socioeconomic communities face greater delays in receiving financial support. Some other prominent critiques of traditional resiliency approach include that it perpetuates economic inequalities, suppresses institutional transformations, ignores power imbalances in politics. However, there has been a slow shift occurring to acknowledge these critiques and address issues of agency and power, as people are expecting more holistic and inclusive responses from government. So in other words, there's a more equitable resilience that is expected from government. So keeping this in mind, we felt that if you can take a step back from the problem at hand being food insecurity, we found that there was an underlying theme that was present throughout this conversation, and that was social inequality. So Rebecca and I thought, why not approach the fundamental cause of the problem rather than the superficial one? So if we look at social inequality, we can see that there are disparities in distribution of goods and wealth, opportunities and rewards and punishments that have existed in the US since its creation. But if we look specifically at income and wealth, we can see that there's been a particular exponential divergence in our society. These graphs on the left illustrate how upper income households have not only seen a more rapid growth in income in the recent decades, but there's also been a sharp and rising wealth gap between the upper and middle income households. And scholars have equated global rises in inequality with struggles between social classes and oppression of social classes. So this is consistent with Marx's conflict theory, and there are four main tenets to conflict theory. So a recap of conflict theory is that there are four. The first is that there is competition for resources. Second, that those with resources are winners and those without are losers. Third, those with resources oppress those without resources. And last, that society, culture, and regulations are shaped to keep those in power with power and those without power oppressed. So these tenets are visible throughout society in the US, and this supports our notion that conflict theory can be used to explain the relationship between social inequality, food insecurity, and resiliency efforts during COVID. So to put it all together, we know that societal poverty and inequality has played a role in creating food insecurity. where low-income individuals do not have adequate access to fresh, healthy foods. Food insecurity is directly related to income, and when income is negatively impacted, food insecurity is more likely to occur. The consequence of food insecurity is seen in both negative health outcomes at an individual level, but it's also seen as an increased spending at a public admin level. Now, if we compare this in the second row to the pandemic, we can see that the food supply chain was severely impacted, especially for low-income population. For example, the cost of goods increased at the height of the pandemic, and there was extreme stockpiling of goods, all of which are added barriers for low-income individuals to purchase healthy foods. We've also seen that unemployment rates have increased in 2020, especially for low-income workers. So this all means that the economic disparities by race and ethnicity and by income and financial stability will only widen further following this pandemic. Therefore, policy actions are needed to address this crisis to not only help during this pandemic, but to create policies that are sustainable and will build resilience for future crises. So we've had all kinds of policy change due to COVID, but because COVID is intersecting with this ongoing food insecurity crisis that was already happening, we believe that this is a unique opportunity to test out, different policies, and that's why we came up with some recommendations that we think can help address the root causes of food insecurity. The first recommendation was to use grants to fund startup costs for mobile produce markets to increase food resources for those without healthy food. And this would expand access to fresh, healthy food, which would decrease food insecurity in low-income communities. As a potential additional benefit, mobile food markets could also increase the amount of fruits and vegetables consumed by low-income areas. This has spillover effects as well for promoting. In addition to promoting equality through food access, people in low-income areas would also eat healthier, potentially reducing health disparities, which is another inequality for low-income communities. Additionally, local farmers who have been hit by the pandemic may also reap benefits from this tool. However, we did see that there have been studies that have shown that mobile food markets are often struggle with sustainability. So we proposed offering a 3-year grant to allow food retailers to establish themselves in their communities and explore innovative ways to self-sustain following the grant period. The second way grants can be used is to fund job training for people without resources to improve their employability and make them more marketable. COVID has resulted in many new jobs that are in high demand now, but they have many transferable skills for the future. So with this grant, targeted job training would be provided in the most impoverished communities, as well as providing funding to employers to provide industry-recognized credentials, all with the intention of improving the employability of individuals. Third recommendation is involving using tax incentives. This should be used to mitigate panic buying during the crisis, which we witnessed early in this pandemic. And this can include incentivizing retailers to provide more local produce, which will not only help increase access to healthy foods, but will also boost the local economy. There are some examples of private and local governments using this type of incentive to reduce food insecurity and promote local healthy food purchase, but it's not very common and widely used. So we believe that local governments should use this and implement this tax similar to the way that they use incentives to encourage opening supermarkets in low-income areas. And finally, our last policy recommendation is a public information campaign to promote empathy and understanding. Public information campaigns have been used to encourage or discourage certain behaviors and to address social inequality during COVID. And things specifically like panic buying, government organizations can implement public information campaigns to promote fellowship and understanding with the goal of changing views. Past public information campaigns have highlighted social issues such as anti-smoking and drinking and driving, and they've shown to change attitudes and cultures. So especially at a time like this, when the working class has been particularly affected and inequalities such as food insecurity have been exacerbated to such a degree that public services and aid are insufficient on their own, a renewed culture of empathy and understanding, and also just an exposure to the realities of how society has been structured to not allow everyone the same opportunities is needed for a better understanding of one another. And moreover, we think that the federal government should be responsible for implementing this campaign, as the governmental response to COVID has been criticized as disjointed and state-specific responses occurred. So we wanted a clear message to be successful for this public information campaign. We believe these policy recommendations will help address the social inequalities related to food insecurity, and by doing so, communities will become more equitably resilient. However, further research is needed to understand the specific needs and policy impacts for low-income communities. So for example, comparing the utilization of broad approaches versus more specific strategies may shed light on appropriate measures for individual communities, and this can help state and federal governments on best methods to use in their capacities. And something more further down the line, we thought it would be of value to have a systematic review on specific policy tools used during this pandemic to address social inequalities. Because of the disjointed nature of the response to this crisis, it would be beneficial to look at responses state by state or even within state and see how that impacted the different outcomes. So thank you for your time, and I look forward to your questions.
All right, thank you very much. I certainly think on that last point, again, the 1.9 trillion we're going to spend on COVID relief includes a lot of trying to address some social inequities. So there'll be a lot of studies probably that come out of that look at let's say, monetizing our tax credit for children, did that have an effect on social inequity? So we're probably ripe for many studies on that activity. Are there any questions or observations from others in the panel or others in the session?
If there are no questions, I would like to ask something, or comment at least. Was this part of Dr. Martin's strategic change and management class? Is this paper for that class? I can see the tools of government, the taxes, incentives, and I'm like, yeah, this is Dr. Larry Martin assignment. I mean, I can see it in my mind. So I was just curious.
This was actually based from our qualifying exam. Rebecca and we took our qualifying exam information and turned it into a paper.
Good. So I think that you touch upon several important points, especially the public information. For example, here in Mississippi, a lot of our residents are low income and they are recipients of food stamps and other welfare programs. So I know when there was the beginning of the pandemic and there was a lot of panic, people out on the social media warning people who are better off in life to don't just pile food in their houses because the benefits are kicking in on the first of the month. And when those people get to the store with their benefits, they're not able to find many of the products that they need. So they were saying, don't do panic buying now, leave some food for those who are waiting for the benefits to kick in so they can go to the store and buy some. So I think that this public information can have a good it's valuable. I think it can be useful. And also because Mississippi is a food desert, how one way that governments have dealt with this is providing transportation. So other than providing these markets to go to them, because it's very dispersed, very rural areas, what they were doing is they were providing weekly buses, and these buses were taking people to go to Walmart or other big grocery stores so they can buy some of the foods they need. So I think it's interesting to see how we as a country will deal with this. But thank you for your presentation.
Thank you.
Okay, I know this is an aside, but UCF's downtown campus is located in a primarily historically Black district, Paramore, and it is a food desert. And I've been interested in the restaurants that, and restaurants is a loose term right now, but we are, because of that, we are bringing in some things like Subway and Dunkin' Donuts. And then prior to COVID, there was going to be a couple other restaurants, not a grocery store, but at least some food options for people in that area. And every time I've gone into those, they have been being used by the local community. So there's a small effect there, but again, still no actual grocery store or produce area. Let's see. Yes. Comment or question?
Hi. Yes, please. I would like to comment and ask. I'm from Israel, and we have a lot of experience with the crises and the emergency times. And here we learn by experience that the local communities in crisis needs to have resilience from within. Since because of the crises, usually the help or the programs from the government or even the local government are more complex because they deal with other things because of the crisis. So did you think about this line of thought of solutions of developing programs for building resilience from within so that in time of crisis, you will be able to, to have resilience without depending on outside forces or outside needs. Politically, it's everything you said is so accurate and normatively it's very, very right. But in life, it's not enough. This is my input about the resilience from within, which is in crisis, especially in risk, especially is more important than anything else. And it's also a very, very good opportunity for to grow the resilience of the community from above.
Thank you. I think that's a really good point that you make to grow resiliency within. I think we kind of briefly touch on that with a couple of the recommendations, like with the job training. Yes, we're providing grants to do the job training, but the idea is to kind of give them the skills to kind of start, like give you the skills and then you do with that and continue on with that to make yourself, it's just to make you marketable, right? And you have to go get the jobs and do the work. But it's not full with resiliency within. I understand the point you're trying to make with that. And I think, from the thought we come from is how can the government help? That's the school that we're thinking from. So it's not the first thought that comes to mind of like, what's a tool that we can that the community can build resiliency within themselves, which is a really good idea of, we should think of something that doesn't involve the government, but all of the recommendations we gave did involve the government in some fashion. But I think also the last recommendation we gave with public information, I think that is in a form building resiliency within. The government isn't necessarily doing anything other than spreading information about the realities of the situation. And it's the community itself that needs to digest that information and do with it what they will to grow that empathy, understanding, and then with that information, if they want to take action, if they want to bring change, then that's the resiliency within. So hopefully that is the stuff that happens.
I must add that part of the resilience from within is the program that you teach by learning the community to build a better communication with the governments through times, so that when we get to the crisis, you can use this these connections.
Yeah.
This is part of the resilience from within, which is very practical and very useful in crisis, because you cannot build anything during the crisis.
Yes, it must be set before the occurrence. I use a paper in one of my classes on social capital and emergency management. And indeed, the first response, just as you're saying, is the social capital within the community. They have to survive on their own for a period of time before help arrives. So.
Which is not a contrast to the need for for progress through the government. It's not right. It needs to come together.
Let's see if Dr. Ahmed, can you hear us, and can you unmute your mic and say hello?
Okay, good evening, everyone. My name is Nuhu Ahmed. I'm presenting from Nigeria. I'm an assistant lecturer with Department of Public Administration, Kogi State University. The topic title is Realities of E-Governance, Rethinking Public Governance in Nigeria within the context of COVID-19. Is it taken? Introduction. In recent time across the world, citizens of various countries are becoming more conscious of their rights, especially as it has to do with their desire to get involved in the decision-making process of their respective countries. This has necessitated the desire of government at every level of governance to recognize the need to provide the necessities of life to the citizens through e-governance. As a result of statement of problem, e-governance is considered as one of the modern mechanisms for the efficient and effective administration of social and economic services in developed nations. However, despite the benefit accrued from the e-government projects, such as expansion in mobile telephoning in a country like Nigeria, Nigeria's lack of infrastructure and functional literacy has impeded the growth of e-government. This study seeks to assess the efficacies of using e-governance in the contemporary era of COVID-19 in Nigeria. Concept of e-governance. Of course, e-governance has been defined variously by different scholars in the literature. But e-governance is the application of ICT in the delivery of government actions, integration of various standalone systems and services between government and other sectors of the society and its citizens. Objectives of the study, sir. The e-governance is to ensure a friendly, speedier, and efficient interface in public governance. It provides a single window for all government services. It ensures transparency in the workings of government. E-governance involves responsive administration. Again, e-governance ensures greater efficiency, objectivity, accountability, and speed in providing services and information to the public. Efficacies of e-governance in the contemporary era of COVID-19 in Nigeria. E-governance has assisted the Nigerian government in the contemporary era of COVID-19 in the following ways. 1, e-governance improves the efficiency and effectiveness of government service delivery. 2, it enables the citizens to transfer information freely without any physical barriers or hindrances. Thirdly, it also enables the citizens, business partners, and employees to have easy access to service delivery. In conclusion, sir, this study argues that when Nigerians have better access to information on available services, such as making payment online, e-learning, that is online classes, doing e-transfer, etc., all this can enhance productivity at both the private and public levels in the country, especially now that Nigerian government considers social distancing as one of the options in curtailing the spread of COVID-19. My recommendation in this study, the federal government of Nigeria is in the e-government project by two, the realization of the governance process in Nigeria and evolve by reducing physical contact and achieving social distancing. The federal government of Nigeria should intensify more effort in achieving greater e-readiness for e-government by investing more in education. In summary, that is the summary of the paper, but I've actually sent in the whole materials to you before now, sir. Can you hear me?
Yes, thank you, Dr. Ahmed. This is Greg Buckingham. We saw your presentation and we heard you.
Okay.
Might I ask you a question?
Please go ahead, sir.
As I read your abstract, at least, there was some discussion of Nigeria's infrastructure and how well it was established to commerce. And I just wondered if you could comment on that.
The infrastructures in Nigeria, of course, Nigeria is a developing African countries that we know. Is one of the strong economics in the African continent after South Africa. But the problem we have in Nigeria is lack of infrastructure, adequate infrastructure. For example, we have this thing we call power, the electricity instability, power, lights, electricity. There is constant power fluctuation in Nigeria that affect businesses and individuals in the country.
Okay, thank you.
So this is one of the infrastructure roads. Nigeria has, okay.
Are there other questions from the group? Okay. All right.
Hello?
Thank you. Thank you, Dr.
Thank you.
Ahmed. There are no more questions, and I want to make sure you know that we shared your presentation in the chat room so that folks can download it.
Okay.
If they wish to.
Okay, sir. Thank you so much.
Yes. All right. Any other comments or general discussion on today's panelists or topics?
Yes, I want to actually commend the organizers of this conference. but it has been perfect. It has been wonderful, and I commend you.
Okay, thank you. And we'll definitely be thinking about that feedback for future conferences.
Okay, sir. Have a lovely day.
Okay.
Yeah.
Anyone else? Comments, observations?
No, just thank you for the comments from everyone about my presentation. I think I got some great feedback for the resiliency things from some of the audience members as well as from the panelists. So I appreciate it.
Well, I do want to thank our panelists, and I certainly appreciate the work you're doing in the topic you're doing that relates to social equity, again, in one way or another. And so thank you for your presentation today, and thank you to everybody else who attended and participated. And with that, we're ending a little bit early, but you've got a time to grab a cup of coffee in the afternoon before our next session.